Do you ever wonder why your child can't seem to sit still, pay attention, or follow instructions like other kids? Are you concerned that their endless energy might be something more? Join us on this journey as we address your burning questions and shed light on what ADHD is, how it affects children, and what you can do to support your little whirlwind of energy. In this video, we'll explore the common signs, the road to diagnosis, and practical tips for managing ADHD at home. Curious? Stay tuned for answers and insights that can make a world of difference for you and your child. Let's dive in and discover the world of ADHD together. Once upon a time in a cozy little town, there lived a young woman named Zara. She was a loving mother to her energetic and curious 4-year-old son. This little boy was named Alex, and he was always on the move, exploring the world with his endless enthusiasm. Alex was a handful, to say the least. He had a hard time sitting still, was easily distracted, and sometimes acted before thinking. While Zara loved his spirit, she also noticed that his behavior was a bit different from other children his age. One sunny morning, Zara took Alex to his preschool, just like any other day. As she waved goodbye and handed him his little backpack, she couldn't shake off the nagging worry she'd been feeling. It was more than the usual concerns parents have when their child starts school. It was a deep feeling that something might be a little different with her son. Over the next few weeks, Alex's preschool teacher, who everyone called Teacher, began to share her thoughts with Zara. She explained that Alex was very clever and creative, but he seemed to have trouble with certain things in the classroom. He couldn't stay seated during story time, found it tricky to follow directions, and often interrupted his friends. Teacher kindly suggested that Zara talk to a special doctor who could help understand what might be going on with Alex. She called it ADHD. This wasn't meant to scare Zara, but to offer help for Alex to do better in school. Zara, of course, had mixed feelings. She appreciated Teacher's concern and honesty but also felt worried about what this might mean for her son. That evening, after tucking Alex into bed, she started researching ADHD on the internet. The more she read, the more she realized that many of the symptoms matched what she observed in her lively little boy. The following week, Zara decided to visit a child doctor who was known for being very understanding and gentle. The doctor's name was Dr. Emily. Zara wanted to find out more about ADHD and how she could support her son. Dr. Emily warmly welcomed Zara and Alex into her cozy office. She listened carefully as Zara shared her concerns. Zara felt that Dr. Emily truly understood her worries. Doctor explained that ADHD was something that could be managed and that getting professional help was a good step to help Alex do better. Dr. Emily then talked to Zara about ADHD in a simple way. She said that every child with ADHD was unique, with their own strong points and things they might find hard. She told Zara not to worry and that they'd work together to help Alex in the best way possible. Zara asked, "Doctor, what is ADHD?" Attention deficit/hyperactivity disorder, ADHD, is one of the most common and most studied neurodevelopmental disorders in children. ADHD is a long-term, chronic, brain condition that causes executive dysfunction, which means it disrupts a person's ability to manage their own emotions, thoughts, and actions. ADHD makes it difficult for people to manage their behavior, pay attention, control overactivity, regulate their mood, stay organized, concentrate, follow directions, and sit still. Kids usually receive a diagnosis during childhood and the condition often lasts into adulthood. However, effective treatment is available. Left untreated, ADHD can cause serious, lifelong complications. Doctor, what are the symptoms of ADHD? Your child's provider will make a diagnosis based on the presence and absence of certain symptoms. The symptoms must have interfered with functioning in at least 2 areas of life, such as school and home, and have occurred for at least the past 6 months. Providers use the signs of ADHD to diagnose and determine the type of condition: inattentive, hyperactive/impulsive, combined or unspecified. Predominantly inattentive presentation. ADHD symptoms in kids with inattentive presentation include difficulty focusing, organizing, and staying on task. According to the DSM-5-TR, a child with this type must display at least 6 of the following 9 behaviors. The behaviors must pose a problem in daily activity, at school and at home, not just from time to time, as most children engage in these behaviors. Predominantly hyperactive/impulsive presentation. People with hyperactive/impulsive type display the following ADHD symptoms. According to the DSM-5-TR, a child must display at least 6 of the following 9 behaviors. These must pose problems in daily activity. Combined presentation. People with combined type display behaviors from both the inattentive and hyperactive/impulsive categories. According to the DSM-5, children must display at least 12 of the total behaviors, at least 6 inattentive behaviors and 6 hyperactive/impulsive behaviors. Doctor, what causes ADHD? Scientists have identified differences in the brain structure and activity of people with ADHD. The frontal lobe is the front part of your brain, the part behind your forehead. The frontal lobe is responsible for planning, paying attention, making decisions, and using language to moderate behavior. Researchers call this kind of activity directed attention. The brains of people with ADHD tend to reach their full maturity at a later time than those of neurotypical people. People use directed attention to suspend automatic attention, a second kind of attention, which is very strong in people with ADHD. Although researchers have discovered these brain differences, they don't completely understand why they occur and lead to symptoms of ADHD. But current research shows that genetics plays a vital role. ADHD often runs in families. A child with ADHD has a 1 in 4 chance of having a parent with the condition. Other possible causes and risk factors of ADHD may include lead exposure, brain anatomy, substance use during pregnancy, premature birth, low birth weight. The following are causes of ADHD: allergies, immunizations, eating too much sugar, too much time staring at screens, poor parenting, social and environmental factors such as poverty. Doctor, what are the complications of ADHD? Without treatment, ADHD can potentially lead to a number of long-term complications. These complications may include poor self-esteem, depression and anxiety, eating disorders, sleep issues, substance use disorder, risky, impulsive behaviors, frequent driving accidents and injuries, trouble with relationships and other social interactions, academic underachievement, job instability. Doctor, how to get diagnosed with ADHD? If you're worried that your child may have ADHD, the first step is to make an appointment with their healthcare provider. Your child's pediatrician can determine if your child has ADHD using a set of guidelines developed by the American Academy of Pediatrics. The guidelines are specifically for children ages 4 to 17. It's hard to diagnose ADHD in children younger than 4 because they can change very quickly, and many kids at this age are naturally overactive or inattentive. It may also be harder to diagnose ADHD in teenagers due to other conditions they may have, such as depression or anxiety. There's no ADHD test to help diagnose the condition. Your child's provider will take several steps and gather lots of information to help them make a diagnosis. The key factor is multiple people observing the behaviors associated with ADHD in different settings, such as at school and at home. A number of people will be involved in assessing your child's behavior, including you, your child's healthcare provider, your child's teachers and other staff members, your child's other caregivers. Have ADHD? There are likely many more adults with undiagnosed ADHD. In some cases, it may be difficult to diagnose ADHD in adulthood due to other conditions such as depression and anxiety. You may recognize the symptoms of ADHD in yourself during your child's diagnosis. To get an ADHD diagnosis as an adult, you must have at least 5 of the symptoms associated with the condition. In addition, there must be evidence that the condition started during childhood. Several additional factors are involved in making a diagnosis, including a history of behavior as a child, an interview with your life partner, a parent or a close friend who knows you well, A physical examination, which providers may give you, but it isn't necessary. Psychological tests, which providers often use, but they aren't necessary. How is ADHD treated? The goal of ADHD treatment is to improve your child's symptoms so they can function more effectively at home and school. For younger children, ages 4 and 5, providers recommend intervention for parents as the first line of treatment before medication is tried. In most cases, the best ADHD treatment for older children, adolescents and adults includes a combination of behavioral therapy and ADHD medication. Behavioral therapy for children younger than age 13, providers recommend parent training in behavior management. For adolescents, they recommend other types of behavioral therapy and training such as social skills training or executive function training. The goal of behavioral therapy is to learn or strengthen positive behaviors while eliminating unwanted or concerning behaviors. Medication can help people with ADHD manage their symptoms and the behaviors that cause issues with their friends, family, and other contacts. Stimulants are the most widely used ADHD medications. Between 70% and 80% of children with ADHD show fewer ADHD symptoms when taking these medications. Non-stimulants don't work as fast as stimulants and generally don't have as big of an impact, but their effect can last up to 24 hours. Your child's provider may recommend the addition of a non-stimulant if stimulants aren't working. Your child may need to try different medications and different doses before they find the right balance between the benefits and side effects. Can ADHD be prevented? Scientists believe genetics plays a major role in the development of ADHD. So, you can't prevent the occurrence of the condition. But there are certain risk factors you may be able to avoid. If you're pregnant, avoid toxins and substances such as alcohol, tobacco, and recreational drugs. This may reduce your risk, but researchers know little about ways to reduce the incidence and prevalence of ADHD. What can I expect if I have this condition? The long-term outlook, prognosis, of ADHD depends on whether your child receives treatment. With behavior therapy and/or medication, most children go on to live healthy lives. Without treatment, people with ADHD may experience poorer outcomes and lifelong complications. These may include trouble managing daily activities, other mental health conditions, substance use disorders, academic or job-related issues such as school failure and frequent job changes. How long does ADHD last? People don't outgrow ADHD, but some people learn to manage their symptoms effectively and may not meet the criteria for ADHD once they've reached adulthood. For some people, ADHD symptoms still affect their functioning. It's a lifelong condition. However, many learn to manage it so that symptoms don't impact their ability to function, allowing them to lead fulfilling lives. How do I take care of my child who has ADHD? Staying healthy is especially important for children with ADHD. In addition to behavioral therapy and medication, leading a healthy lifestyle can make it easier for your child to deal with their symptoms. Healthy behaviors include eating a healthy diet full of fruits, vegetables, lean proteins, and whole grains. Exercising or participating in regular physical activity. Limiting screen time. Getting the recommended amount of sleep. What are some additional strategies for managing my child's ADHD at home? You may find the following strategies helpful for managing ADHD in the home. Limits to behavior are critical to managing symptoms. Give clear and specific directions and limits. Children with ADHD need to know exactly what others expect from them. Catch your child being good. Punishing a child only teaches them what not to do. Recognizing and acknowledging positive behaviors is an effective way to teach your child what to do. This increases the use of appropriate behavior. Discipline effectively. Create a consistent system to reward appropriate behavior and respond to misbehavior with alternatives such as a timeout or loss of privileges. Watch what you're paying attention to. When parents pay attention only to inappropriate behavior tends to increase. It's often useful to learn to pay attention to appropriate behavior in the household. Stick to a schedule. Follow the same routine every day, from wake-up time to bedtime. The schedule should include time for homework and play. Use a calendar or planner your child can see. Create a place to write down important reminders, responsibilities, and events. These tools may be especially helpful for adolescents and young adults who struggle with time management. Pick out a homework area. Set up a home workstation for schoolwork in a quiet area without clutter or distractions. Set a timer. Have a time frame for working on homework. If your child doesn't finish, take a break and set a new time to finish. Praise effort and completion. Reward your child's completed work instead of punishing incomplete work. What does ADHD stand for? ADHD stands for Attention Deficit/Hyperactivity Disorder. The meaning of ADHD helps define the condition. Children with ADHD often have difficulties with inattention and hyperactivity, as well as impulsivity. Almost all children have moments of daydreaming, misbehavior, and/or distraction. But for children with ADHD, these moments are more than an occasional concern. The behaviors occur so frequently and at such an extreme level that they interfere with their ability to function effectively in daily activities. Is ADHD a form of autism? No, ADHD isn't on the autism spectrum. But autism spectrum disorder and ADHD are both neurodevelopmental disorders. They share some of the same symptoms. In addition, if your child has one of these disorders, their chances of having the other may increase. Is ADHD a disability? Yes, the Americans with Disabilities Act, ADA, considers ADHD a developmental disability. The challenges the condition presents can make it difficult for your child to perform their daily activities and function efficiently at school. Therefore, your child may qualify for special education and/or modified instruction in school accommodations. Are there advantages to having ADHD? Yes, people with ADHD have many abilities and skills beyond those of people with neurotypical brains. Some companies deliberately hire people who are neurodivergent because of these advantages. These abilities and skills may include hyperfocus, nonlinear thinking and problem solving, resiliency, creativity, conversational skills, spontaneity, ample energy. Why is ADHD commonly underdiagnosed in girls and children assigned female at birth? Girls are just as likely as boys and children male to have ADHD. The condition often looks different in girls, but ADHD affects both sexes equally. Girls tend to show more inattentive symptoms in younger ages than boys, who show more hyperactive symptoms that are readily observable. Despite widespread improvements in diagnosing the condition, some healthcare providers still work with outdated stereotypes that the condition affects boys more. And so, Zara's journey with her energetic son, Alex, began. Their small, cozy town became a place of understanding, patience, and endless love. Zara knew that Alex's spirited nature was a gift, a unique quality that just needed a little extra guidance. With teachers' support and Dr. Emily's gentle wisdom, Zara learned that ADHD was not a roadblock but a pathway, a journey they would take together. And as the days turned into weeks, and the weeks into years, they faced each challenge with hope, determination, and, most importantly, love. In this warm and supportive community, they watched Alex grow, embracing his boundless curiosity and unstoppable energy. They realized that with the right kind of support and understanding, there were no limits to what he could achieve. As they moved forward, their story became a testament to the power of love, patience, and the unwavering belief that every child, no matter how lively or unique, could shine brilliantly. Zara, teacher, and Dr. Emily, together with parents and professionals all around the world, were united by the same mission, to help children with ADHD thrive. And now, dear friends, as we conclude this tale, we invite you to join this community of understanding, empathy, and hope. If you found this story inspiring or helpful, consider subscribing to our channel. By doing so, you become part of a network dedicated to supporting parents of children with ADHD. Let's continue to share our experiences, insights, and the support that parents like Zara need. Because together, we can create a world where every child, no matter how lively or unique, is given the opportunity to shine. Thank you for listening, and we'll see you in the next story.